It's been no secret that state and local leaders, as well as business owners, have been eager to get back to business in the wake of the COVID-19 outbreak. But are they jumping the gun?
Some good news tonight on that front. New numbers obtained by News Channel 13's Chase Golightly indicate we're actually in pretty good shape. Good evening, I'm Bart Bedsole.
And I'm Heather Skold. Thanks for making us your choice for your news at 10 o'clock. We begin tonight with an assessment on just where we stand when it comes to slowing the spread of the coronavirus.
It's true that Colorado is seeing the fewest COVID-19 hospitalizations since the pandemic started, but is that the case here in Colorado Springs and Pueblo?
News Channel 13's Chase Golightly joins us live outside UC Health Memorial Central with a number of COVID patients currently being treated at the major hospitals in our area. Chase.
Heather, Bart, it appears that there are currently less than 15 COVID-19 hospitalizations at the major hospitals here in El Paso County, like this one right behind me. But even with that, it's surprising to hear that with that decrease, it appears that state hospitals won't return to full capacity anytime soon.
This week, Governor Jared Polis announced an all-time low of coronavirus hospitalizations at Colorado hospitals. So how many are currently recovering at hospitals in our area? According to the El Paso County Public Health website, so far in June, there have only been 7 new hospitalizations. That's half of what we saw in the first 10 days of May. We reached out to the major hospitals in our area so we could also include patients who may have checked in prior to June. Even then, at UC Health Memorial Central and North, fewer than 6 people are currently hospitalized at their facilities. And it's the same for Penrose Hospital and St. Francis Medical Center. Fewer than 6 people currently hospitalized at both locations. Parkview Medical Center in Pueblo currently has 4 patients hospitalized with COVID-19. However, an official tells us none of them are on ventilators. With fewer hospitalizations, Kara Welch with the Colorado Hospital Association says state hospitals are slowly returning back to normal, including rehiring some furloughed workers.
So it's not like we flipped a light switch and have gone back to 100% of what we were doing before COVID. It's definitely more turning that dial and kind of gradually ramping things back up again.
And that's good news. But remember, Colorado hospitals have already taken a huge hit. Countless elective surgeries have been canceled, and there have been fewer ER visits, not to mention the increased spending for personal protective equipment. All told, Welch estimates that Colorado hospitals will lose $4.1 billion this year alone, which could mean many staff members might not have a job to return to.
You really have to examine your staffing levels and what's appropriate and what you can do that's in the best interest of your business and then the service that your business looks to provide.
Welch told me state hospitals did receive $1 billion in federal support funding. But again, that only covers a quarter of the total amount of money they're expected to lose this year. Reporting live in Colorado Springs, Chase Golightly, KRDO News Channel 13.
All right, Chase, thank you. And we do want to be clear here. Those numbers are both comforting and encouraging when it comes to reopening our state, but in no way does KRDO endorse relaxing the health precautions that are currently in place. The biggest reason our numbers look so good here in Colorado is because state leaders reacted to the pandemic quickly, and those precautions need to stick around a while longer as doctors race to find a vaccine.